Hello and welcome to Omnia Health Insights. My name is Deepa Narwani and I'm the senior editor at Omnia Health Insights, your one-stop resource for all that's happening in the global healthcare industry. May is Mental Health Awareness Month and it's International Nurses Day on May 12th. Today, the emotional well-being of nurses is being challenged like never before by COVID-19. Long hours caring for patients, fears about contracting the virus, separation from loved ones. The pressure on nurses has been unrelenting since March last year, especially in hard hit countries like India. Today, to discuss this very important issue, we have with us Dr. Shekhar Saxena, Professor of the Practice of Global Mental Health at the Department of Global Health and Population at the Harvard T. H. Chan School of Public Health. A psychiatrist by training, he has served in the World Health Organization since 1998. His expertise includes providing advice and technical assistance to policymakers on prevention and management of mental, developmental, neurological, and substance use disorders and suicide prevention. Welcome to Omnia Health Insights, Dr. Saxena. Firstly, I would like to ask you what has been COVID 19's impact on mental health, especially for frontline workers?
Thank you, Deepa, for inviting me. COVID-19 obviously is a very major public health crisis all over the world and also in India. And we do know that it's infecting a lot of people. It's also giving rise to severe illness, and unfortunately, many people are dying. But the mental health impact of COVID-19 pandemic has been underestimated. It's actually given rise to a very large impact on people's mental health and well-being. All of us are at some point on our mental health. And if we were coping up well, we now find it more difficult to cope. If we had some psychological symptoms, those become more, and we can even have a mental disorder, which can be diagnosed. And if we already had a mental disorder, it becomes much more severe and much more disabling. And in a way, the COVID-19 is demonstrating that mental health is so very important for us and for all of us, not only those people who have a mental disorder. It has actually obliterated the dividing line between what we used to call mental disorders and others who didn't have. We are all in the same boat now.
Okay. And so, what has been the impact of mental health impact on frontline nurses in India?
Uh, COVID-19's mental health impact is on everybody, but on healthcare providers, including doctors, nurses, and other staff, it's having a very severe impact. Take the example of nurses who have long hours. In fact, now some of them are working all around the day. They can hardly get any time for rest or sleep or even for eating. They are wearing all those PPEs, which are essential but are very uncomfortable, especially if the temperatures and humidity are not controlled well, which is the case for many of them. They also have the risk of infecting themselves. And unfortunately, many of them have got infected. Some of them have actually died because of the infection and infecting their family members. So there is a lot of fear besides overwork. And there is a lot of uncertainty also. What's going to happen tomorrow? What's going to happen in a week's time? And all of this is giving rise to very severe mental stress, and in some cases, severe anxiety and depressive symptoms. It's also compounded by losses. It's losses sometimes in their own family, but constant losses at work. They're losing patients, and this gives rise to a very severe crisis, almost of the profession and a personal crisis. What are we doing? Are we doing something good? If so many people are dying, is there something really wrong with our services? And this raises questions which are very difficult to answer at this time, but do give rise to a very serious psychological impact. And unfortunately, in some cases, this is going to give rise to a complete burnout, which is obviously bad for the nurses, but it's also bad for the public health care system because we have so much deficiency of nurses. And if we lose some of them by death or by going out of profession because they simply can't cope, is going to give rise to a significant increase in the crisis that we are facing now and for long term.
So, what are some of the strategies that frontline health workers like nurses can use to protect their mental health during these uncertain times?
Well, it's our responsibility to look after ourselves besides looking after others. And I think that applies very clearly for healthcare providers and especially for nurses. You know, the airlines make an announcement if there is an emergency, put your own oxygen mask first before you put it on others. And I think the same thing should apply for healthcare providers. They are in the profession of helping others. Always on their mind is how can we help our patients more? But they are not able to help more if they don't look after themselves. So it is very important for them to keep self-care, especially for stress and other needs like sleep, like rest, like at least some exercise, definitely as a part of their routine. Yes, work is important, but it's also important to look after oneself. And that is really a very important message because most of the time they are actually working and not looking after themselves, which over a long time is going to have very adverse effect. Besides that, they should also implement certain measures that will be useful. For example, they need to have a daily routine which is as regular as possible because if you do night duties and day duties and a very irregular schedule, then your body and mind cannot really have enough time to rest, and also the diurnal rhythm is lost. So I know that it's difficult to implement, but yes, they can try. They should also look after themselves and other colleagues because helping others is actually helping oneself. So, we have, of course, safety precautions that you're not supposed to be too near other people and all of that. But physical distancing does not mean social distancing. We need to use all the possibilities on talking to others, asking them how they are amongst colleagues. And if there is a need, they should look after that. They should also take time for talking to others and actually sometimes even for themselves, doing things which give them pleasure. Even in the middle of all of this crisis, if you take out 5 minutes to really sit, reflect, just do breathing exercises, that is really very helpful because the constant pressure of work really can bog you down very much. Lastly, I know that many of the nurses are seeing very seriously sick patients. Sometimes they are dying for no fault of theirs because there may not be oxygen, there may not be enough equipment, enough drugs. They should realize that there are things that they can control and help, and there are other things which they cannot control. And making the difference between the two is really critical for looking after oneself because you can start blaming yourself for things that are not in your hands, which are not in your control. And that has to be avoided because otherwise the self-blame and the frustration really can overpower you. So that's my advice to nurses. Just realize that there are things that they can do and they should of course try to do them as best as possible, but there are other things which they cannot do and they should not take the responsibility for that.
You said some really amazing things. What role can hospitals now and healthcare institutions play in mitigating the negative psychological impact that these nurses are facing on a daily basis?
Well, hospital administrations and supervisors have a big responsibility to see to it that nurses are not put in the most difficult situation or even sometimes impossible situations that they are put in. So keeping the work schedule as light as possible. I know it's difficult, but still some predictability and enough time for rest and recuperation is absolutely necessary. You can flog somebody so hard that you can get some work done today, but tomorrow will be another story. So they really need to plan medium and long term to see to it that the pressures are not too much. They should have enough manpower or woman power, if you like to call that, so that the work can be done satisfactorily, but nobody is put under tremendous emotional pressure. They should also take responsibility for providing enough safety precautions. For example, PPEs, other equipment which are for safety and security, and also for patient care, so that the nurses and other healthcare providers can work to their optimum level. They also have a responsibility to encourage discussion between them and also be open to discussing with nurses any problems that they are facing and try to solve them as much as possible, and also broach the subject of stress, anxiety, depression, frustrations, which are very common nowadays and in this second wave of the COVID-19, so that there is somebody to listen to and there is somebody to do what is possible to decrease some of these. Listening helps a lot. So if the supervisor is actually just taking out 10 minutes and in a group of nurses is willing to talk about what situation they are facing, and also sometimes about the emotional and psychological factors, that will really be very helpful, because listening and talking is the first step towards decreasing one's stress. Lastly, they need to see to it that if there is need by anybody who's having excessive stress or frank anxiety and depression, then help can be provided quickly and effectively without stigmatizing. Sometimes we find it very difficult to talk about our own emotional problems. They should encourage it, and if there is a need, they should provide help in terms of counseling, in terms of psychological help, and sometimes in the sphere of specialist help, which may be necessary. After all, nurses are part of the community, and if all of us are facing so much stress, we need to be aware that sometimes help is needed and must be given.
Amazing. Thank you so much for so many wonderful insights today, Dr. Saxena. Thank you for your time, and I look forward to speaking to you again very soon.
Thank you very much, Deepa.
Take care. Thank you.